359th webinar on infertility series, one wellness series. Two series are inspired by Professor Kamini Dhimanji. Today, conducting webinar on woman wellness series. Today's topic is Karnini Yonivyapad, cervical erosion, and the case series will be presented by Dr. Jyoti Mehra. I would like to welcome Dr. Jyoti Mehra ji for her valuable presentation, experience sharing, and case study presentation. She is Assistant Professor, Department of Prasuti Tantra and Stri Rog, Sri Dhanvantari Ayurved College and Hospital, Chandigarh. And I am grateful to Professor Kamini Dhimanji, Professor and HOD of Department of PTs SR, All India Institute of Ayurveda from New Delhi. Welcome, madam, both of you. And I would like to welcome all YouTube viewers as well as audience directly join, because audience is also expert. They are not audience only. They all are expert and here to share their experiences also. So definitely I'm welcoming all experts on the dais and would like to request Professor Kamini Dhimanji to coordinate and conduct the session. Professor Kamini Dhimanji.
जी नमस्कार पवन सर, बहुत बहुत धन्यवाद आपका. एंड आई वुड लाइक टू वेलकम ऑल दी पार्टिसिपेंट्स नहीं, ऑल दी एक्सपर्ट्स भी बोल सकते हैं, जैसे पवन सर ने बोला कि ऑल दी लर्नेड पर्सन्स हु हैव जॉइन ओवर हियर, फैकल्टी भी बोल सकते हैं. एंड वेलकम टू डॉक्टर ज्योति, टुडे स्पीकर. Today's topic is cervical erosion. Generally, cervical erosion is the thing कि patient आपके पास ये complaint लेकर नहीं आता है कि I am having cervical erosion types. जैसे कि आजकल सारे हमारे पास patients reports लेकर आते हैं कि मुझे PCOD है, मुझे ये fibroid है, मुझे cyst है. But this condition is examined, checked and diagnosed by consultant herself or himself only. पेशेंट्स अपने पास आते हैं कंप्लेन लेकर, मैडम कभी मुझे वाइड डिस्चार्ज एक्सेसिव हो रहा है. समटाइम्स पेशेंट्स आर हैविंग कंप्लेंट ऑफ कॉन्टैक्ट ब्लीडिंग. और बहुत बार ऐसे होता है कि पेशेंट्स की वाइड डिस्चार्ज की प्रॉब्लम है, चेक नहीं किया, जनरल प्रैक्टिशनर के पास गए, उन्होंने जनरल टैबलेट्स दे दी, ओरल मेडिकेशन दे दिया और पेशेंट को फायदा नहीं हुआ. इवन देन रिपीटेडली पेशेंट बार बार ये सब लेती है और पेशेंट को इम्प्रूवमेंट नहीं मिलता है. देन दे कम टू अस या स्पेशल ओपीडीज या गायनेकोलॉजिस्ट के पास आते हैं कि नाउ वी हैव टू कंसल्ट. इनके पास जाते हैं ये प्रॉब्लम के लेके जनरली. तभी हम लोग जब पेशेंट को चेक करते हैं तभी हमें पता चलता है कि पेशेंट इज हैविंग सर्वाइकल इरोजन. अदरवाइज डायग्नोसिस इसका नहीं हो पाता है. तो सर्वाइकल इरोजन है और कितना एक्सटेंशन है, कितना एक्सटेंसिव है, एंड हाउ वी हैव टू चेक दैट कंडीशन और एसोसिएटेड कंप्लेंट और क्या हो सकती है, उसमें क्या इन्वेस्टिगेशंस करा सकते हैं, और बेस्ड ऑन दोज इन्वेस्टिगेशंस हाउ वी कैन अप्रोच इन दिस कंडीशन, वो थोड़ा सा हम लोग अभी डिस्कस करेंगे. एंड आफ्टर द प्रेजेंटेशन ऑफ डॉक्टर ज्योति वी विल हैव क्वेश्चन आंसर सेशन discussion and expert coming from expert faculty who have joined over here. So over to Dr. Jyoti. She will share her presentation. Yeah, welcome to you. आप अपना presentation share करें और then we will have question answer session.
Yes. Ma'am, is it visible?
नहीं बेटा, इसलिए हम हमेशा स्पीकर को 5 मिनट पहले ज्वाइन करके शेयर करने की प्रैक्टिस कराते हैं जनरली. मोबाइल से ज्वाइन शेयर करोगी?
Yes, ma'am. I was connecting with laptop, but it
नहीं तो
was
तुम
not
मुझे
coming.
व्हाट्सएप कर दो, हम शेयर करा देते हैं पवन सर को बोल के.
हाँ जी.
मुझे मुझे भेज दो पीपीटी, मैं पवन सर को,
हाँ जी मैम।
है ना, तब तक ऐसे ही
Yes.
बोलना कर सकते हो, ठीक है? ही विल शेयर, तो
हाँ
मुझे
मैम
भेज,
सेंड।
हाँ भेज दो मुझे।
अच्छा, हाँ मैम सेंड।
जी
Good
जी
evening, everyone. Thank you, ma'am, for giving me this opportunity to present here the cervical erosion Karnini Yonivyapad case series. As we know that the cervical erosion is very common problem, and ma'am already has told like we can't diagnose, like a patient will not come with the with the specific thing like that she had cervical erosion. It can be diagnosed accidentally, like by doing the pervaginal examination. Patient mostly comes with the this white discharge. Complaint of white discharge is the most common thing associated with the disease like cervical erosion. And the incidence and prevalence rate is also very high nowadays of cervical erosion. Approx 80 to 85% patients in OPD accidentally we are discovering that they are having the cervical erosion. Karnini Yonivyapad. So today we will discuss about the cases regarding the cervical erosion, and before that we will do some basic things like we'll do some theory about the Karnini Yonivyapad and the cervical erosion.
Your PPT is being received. Just within 1 minute, I am going to share.
Yes, sir.
या विजिबल।
First, we'll go through the that Nirukti definition. It is given by many acharyas like Acharya Charaka, Acharya Sushruta, Acharya Vagbhata, and Madhav Nidan also. Okay, the first thing is that the Nirukti is according to Acharya Charaka, it is given in the Chikitsa Sthan, that is 30 by 27. Karnikam iti Karnikaram Granthim. That Karnika is like we can correlate it with the uh, like pericarp of the lotus flower according to Acharya Charaka. And next is Karnika Maskandi. Sushrut Samhita Uttar Tantra 38 by 15 Dalhan Tika. A protuberance of the flash is called the Karnika. Like the in cervical erosion, that eroded part can be considered to the pericarp of lotus flower, or the protuberance of the flesh is called Karnika. Next is according to Acharya Vagbhat, Karnikam Padam Karnikam Tulyam Mas Ankuram iti Atyartham. Elevations of resembling pericarp of lotus flower. Next is Karniniam, Karnikiti, Karnika, Maskand, Akar, Granthi. Hence, by all the references, it can be concluded that minute elevations or protuberance resembling the Padam Karnika. Like the according to every acharya, it is like correlated with that pericarp, or that erosion is like protuberance or the elevations of that cervical epithelium, that is called as the Karnika. Next. Next. Nidan, we'll go to the Nidan. First, we'll discuss about that according to Charaka. Akale Vahamanaya, that is Akal Pravahan. Like in the absence of Avi, or in the absence of uterine contractions, if the woman is bearing down, that is called as the Akal Vahamanaya गर्भेण पिहितो अनिल. दैट द जो मतलब गर्भ के द्वारा जो भी प्रकोप रुकी हुई वायु होती है, that is obstructed by the fetus is vitiated, that leads and that withhold the cough and rakta, and form the Karnika-like growth in the yoni, which is called as the Karnini Yonivyapad, according to Acharya Charaka. And the result is that it will lead to the Rakt Marg Avrodhinaya, means that Rajo Marg will be it will cause the hindrance to the Rajo Marg. Same is like according to Acharya Sushruta, Karninayam Karnika Yoneo Sleshma Asrik Bhayam Prajayate Chat Srishvapi Chadayesu Sleshma Lingochit Bhavit. Like it is also associated with that if Vayu is prakupit and it is withhold with the Sleshma and Asrik, that is Rakt, and the and which result in the generation of that kapha related symptoms like kandu, etc. Next. Next, we'll move to the Acharya Vagbhata. Akal Vahanadip Vayu Sleshma Rakta Vimuchita Karnikam Janyed Yonyo Rajo Marg Nirodhinim. Same is like this because of that when the uterine contractions are absent and in the absence of avi, if woman is bearing down, same is like that vayu will be prakupit and it will associated with the rakt and the kapha, which leads to the formation of karnika in the yoni and result in same rajo marg nirodhinim. In modern we can correlate like because of the inflammation and which leads to the discharges, vaginal discharges, and leads to the hindrance of the sperm's entry also, which may result into the infertility in later stages. Next. Next. We'll move towards the cervical erosion. In Ayurveda, we can correlate it directly to the cervical erosion. First, we'll see the incidence. Cervical erosion is a benign gynecological condition seen in OPDs that frequently occurs in women of reproductive age group. Next is, according to calculations, approx 80 to 85% of women of childbearing age have cervical erosion. As we can see in OPD also, a number of patients, like 5 patients out of 10, if we are seeing the complaint of white discharge, they are having the cervical erosion. When we'll do the examination, per vaginal examination, we can see that red velvety area, that is the extra proliferation of the columnar epithelium of cervix. Introduction of cervical erosion is, cervical erosion is the interplay between two epithelia. Cervix is formed of two epithelium, and it is a condition where the squamocolumnar epithelium of the ectocervix is replaced by columnar epithelium, which is continuous with endocervix. Clinically, it is defined as the development of red velvety area on the portovaginalis around the external os, occurs due to increased exposure of the cervical epithelium to the to estrogen. Like most common causative factor is when the estrogen is more. If like we are taking the OSI pills, or we are if the estrogen is more in the body, it will leads to the excessive proliferation or of cervical epithelium, which leads to the red velvety area around the portovaginalis and around the external os. And it is diagnosed on the routine pelvic examination or by pap screening. Next. We'll move forward. Like types of erosion. Mostly the two type of erosion is there, congenital erosion and the acquired erosion. Congenital erosion at birth, mostly it is seen at the birth. About 1/3 of the female newborn, the columnar epithelium, endocervix, extends beyond the external os and covers the portio vaginalis of the cervix due to the influence of maternal estrogen. Mostly it is associated with the influence of the maternal estrogen. The congenital type of erosion will be seen in the female, in the baby female. As the estrogen level in neonate falls, the condition reverts the and erosion will disappear. Next is acquired. The squamocolumnar junction is not static. When the estrogen levels are high, it moves outwards where the columnar epithelium extends into the portia vaginalis, causing the erosion. Next. Now we'll move towards the causes of cervical erosion. First is physiological causes, like common during the puberty and pregnancy, purpurium, due to effect of sex hormones. Second is congenital, as we have seen in the neonate, it is due to the effect of maternal estrogen. Third is hormonal. Fourth is due to the infections, pathological as acquired lesions results from the hyperplasia of epithelium. And fifth is environmental factors are also there. Sixth is certain diet habit. As in Ayurveda, we know the importance of diet. So it also may result to the vitiation of doshas, which leads to the cervical erosion. Next is we'll see about the pathogenesis. It mostly is divided into two categories. First is process of formation and second is process of reepithelialization. First is process of formation, that is denudation or formation of erosion. Next is process of reepithelialization, regression of erosion. As we are seeing in these two pictures, first is in a picture, like there are two type of things like original squamocolumnar junction and the new or active squamocolumnar junctions, and in between the original squamocolumnar junctions and the active squamocolumnar junctions, the transformation zone will be there. That and here only that in the that transformation zone, the squamous metaplasia takes place. Next. We'll see about the squamocolumnar junction and the transformation zone. The ectocervix is lined by the squamous epithelium and endocervical canal, columnar epithelium. The junction of these two epithelia is called squamocolumnar junction. When the estrogen is high at puberty and pregnancy, the columnar epithelium extends on to the portia vaginalis, causing erosion. The original squamocolumnar junction is on the ectocervix, and after menarche, the squamous metaplasia takes place, replacing the columnar epithelium, resulting in a new active squamocolumnar junctions moving inwards. The area between the original and active squamocolumnar junction is called the transformation zone. Next. And this area slowly begins to produce the glycogen, thereby resembling the original squamous epithelium. In the process of replacement of mucus secreting columnar epithelium by squamous epithelium, at times result in the formation of Nebuthine cyst. Like we are seeing in the OPD also, while doing the pervaginal examination, like small, like whitish structures, round structures are visualized. That is the formation of Nebuthine cyst. This transformation zone is susceptible to oncogenic factors and CIN develops. Next. Here we are seeing that the transformation zone. And while doing the examination, first thing is what is visualized while doing the examination. पर speculum examination, a bright red area. जब भी हम per speculum examination करते हैं तो हमें एक bright red area और red velvety area is seen with the clearly demarcated outer edge, and lesion may be smooth or having small papillary folds on them, and discharge may be present through the external os, and it is visible also. And per vaginal examination, if we are doing, the granulation may felt and the grating sensation may felt due to the cervical erosion, because there is the excessive proliferation of that columnar felt during the per vaginal examination. Next. Clinical features, like how in OPD patients presents you. Mostly she'll complain with the symptom of, the basic symptom is like vaginal discharge. Vaginal discharge लेके हमारे पास patients आते हैं. and sometimes they are having that intermenstrual bleeding also and the contact bleeding also. Contact bleeding reason can be there because because increase in the fragility of the capillaries at that particular area, and during the intercourse, the patient may feel the bleeding is there and the dyspareunia is there. And third symptom is like patient can come with the complaint of low backache and the abdominal pain, and in later stages it may lead to the infertilities also, dyspareunia and it is mostly associated with the cervicitis, because when we will do the pap smear examination, mostly it will be associated with the cervicitis, as it will come like the inflammatory smear. And if we'll do the vaginal swab also, mostly infections are associated with the cervical erosion. Next. Now we'll see like how we will do the assessment of cervical erosion. First is we'll see the location of cervical erosion. कि look कि cervical erosion कहाँ है. On the external loss we are seeing, and whether it is present over the upper lip, and whether it is present over the lower lip or both the lips. And extent of cervical erosion. Cervical erosion, like we know that the cervix organ is deep in situ, so we can't measure exactly. So we and the cervix is the round structure, so we can divide into the parts, like how much percent is there. 30% extension of cervical erosion is there, 60% extension of cervical erosion is there, or the cervical ectocervix is fully covered. And the vaginal discharges, we can also see like type of vaginal discharges, like whether it is white discharge and or yellowish discharge, greenish discharge. So this is how we will do the assessment. That first is location, second is extent, like how much it is spread, and third is vaginal discharges. Next. Next we'll see the principle of treatment. The most common thing is that we'll go to the like how we can destruct the overgrown columnar epithelium. Like principle is like we have to destruct the overgrown columnar epithelium. And in modern we are following that cauterization is the basic concept. Diathermy cauterization we can use, cryosurgery is we can use, laser therapy we can use. And if everything is failed, and lastly we can go for the amputation of cervix on in later stages. If child is not required, and patient is not in the reproductive age also, we can go for the hysterectomy. Next. Now we'll see in chikitsa like what we are doing in on the daily basis in our OPD basis, what we are doing in Ayurveda. First is sthanika chikitsa. This is the most common thing we are doing, sthanika chikitsa. And first thing is that yoni prakshalana. Yoni prakshalan with kashai preparations of shodhan dravyas. Mostly we are using the shodhan dravyas because of its antimicrobial actions, antibacterial actions, and and like nimba we are using, panchvalkala we are using, triphala we are using, aragvad, durva, palash, nalpamar. And these are the basic drugs we are using on our OPD basis for the yoni prakshalana. And next is varti can also be prepared by the shodhan dravyas like kusht, pipli, and sandha. Pipliadivarti we can use for the treatment of that vaginal discharges also. Yoni pichu with the medicated tela or ghrita like Jatyadi tela, Nimba tela, Durvadi ghrita or Durvadi tela. We are using this. And Shar karma for the external application like Pratisarniya Shara like Apamarg, Snuhi, Tankan, and Palash Shara. These are the basic drugs we are using on our OPD basis for the treatment of cervical erosion. Next. Now we'll see like how they are acting, how like what is the mode of action of the sthanika chikitsa. First is like shar karma. Shar acts as a corrosive agent which is used externally for any growth, used in eroded cervix. Among old shastra and anushastra, Acharya Sushruta has already told Shara is the superior because it is more effective and acts immediately. श्लोका is there. शस्त्र अनुशस्त्रेभ्य शार प्रधानतम छेद्य भेद्य लेख्य करणात् त्रिदोष घनत्वाद विशेष क्रिया अवचारणाश्च. लाइक इन शस्त्र एंड अनुशस्त्र शार को हमने श्रेष्ठ माना है, शार को प्रधान माना है, बिकॉज इट इज हैविंग द प्रॉपर्टीज लाइक छेदन भेदन लेखन, एंड बिकॉज ऑफ दीज प्रॉपर्टीज इट विल लीड्स टू द दूषित मांस हरण. जो भी वहां का जो पर्टिकुलर हमारा जो मांस है, सर्विक्स सर्विक्स इज ऑल्सो इज लाइक फ्लैश, मांस है, उसके छेदन भेदन और लेखन के लिए और दूषित मांस हरण के लिए हम शार को यूज करते हैं. एंड इट इज ऑल्सो हैविंग त्रिदोष घन प्रॉपर्टीज ऑल्सो. Mode of action is of Shara is destroy targeted superficial cells, and next is regeneration and epithelialization. Epithelialization is the last stage, like we are destroying the columnar epithelium, and in later stages it will turn into the squamous epithelium. Next. Next, we'll go to the Yoni Pichu. Pichu Carpastulam. Like it is made up of gauze or cotton. We used to make. And Pichu Telam, Pichuna, Tulken, Telam, Vatghan Dravya, Kwat Siddham, Yonishu Dharyet. In Sushruta, in Dalhan Tika, it is said. With the help of Vatghan Dravya, Siddh Tel or Kwat को हम और के साथ हम पिच्चू को योनि में धारण करवाते हैं, बिकॉज इट इज योनि दोषहर. एंड तेलाज आर मोस्टली प्रेफर्ड मीडिया. हम तेल और घृत को सबसे ज्यादा क्यों यूज करते हैं, बिकॉज दे आर योनि विशोधनार्थ, एंड इट डिमिनिशेस द चांसेस ऑफ इन्फेक्शन इन जेनेटेलिया. एंड तेलाज ऑल्सो हैज द वातघन प्रॉपर्टीज. And why we are using this media is that because our vaginal epithelium and the cervical principles. So we are using the tela and ghrita preparation for the univichu. Other preparations can also be used, like gel preparations also, swaras preparation also. It remains for a long time for better action due to well absorption by vaginal and cervical tissue. And size of pichu is not mentioned in our sahitas, and approx the patients we are using, like 3 into 3 centimeter soaked in the 5 to 10 ml of oil is preferred, and it should be retained till amutra kal or 3 hours, or when the patient was asked to follow, whichever occurred first. Next. Next is Yoni Prakshalana. During the process of preparation of kashaya, when we are making the kashaya, we are preparing the decoction, and in the decoction, the active principles of the drugs get mixed into the water, and it makes the decoction more concentrated and potency is increased. The basic concept of using the kashaya is because of its concentration and because of it's increased in potency. So we are using the kashaya preparation for the yoni prakshalan. And the moderate warmth of the kashaya increases local blood flow, which helps in the elimination of infection by mobilization of macrophages and their toxic inflammatory products. Like because of increase in the blood flow in that particular area or capillaries, which helps in the elimination of infection and the toxic inflammatory products, and this reduces the tissue damage, pain and redness, and it will help in the reduction of all the symptoms of erythema, and due to removal of stagnation of blood flow, accumulated extravascular fluid is also mobilized and edema is reduced, and it drains the infected vaginal secretions and wash out the entire vaginal canal, and most important thing is it maintains the vaginal pH. Next. Now we are moving to our cases. First case I am discussing here. Married female of 28 years with complaint of white discharge per vagina associated with itching and burning sensation over the vulval region since 6 months. Came to our OPD and she was having the low backache also since 6 months. And she gave the history, like we asked her कि whether she did the bearing down, और जब उसको like contractions नहीं थी तो वो बहुत ज़्यादा like she was pushing down. So she gave history of bearing down during the labor, and her menstrual history was 4 to 5 days bleeding, 28 to 30 days cycles. Pain, smell, clots associated with that menstruation was absent. Obstetric history was parity to live birth to, no abortion, and L2 was normal delivery, male, 1 year back, and vitals was normal. We did the speculum examination, and we saw like cervix was hypertrophied, swelling was there, and erosion was present on both the lips, and white discharge per vagina. From the external os, we were seeing the white discharge. And per vaginal examination, uterus was anteverted, it was normal in size, and mild tenderness in the lateral fornices also. Nidan Seven, according to that patient, it was there like she had the history of Vegadharan also, and Akal Vahamanaya. Like we have already described what our acharyas said, and it is like it leads to the vitation of Apanavata. Because of these Nidan Seven, vitation of Apanavata was there, and it will leads to the vitation of Yonigat Kapha also, and then it and both Apanavata and Yonigat Kapha leads to the Sthanika mass and Rakta Dhatu Dushti, and result in the formation of Karnika over the Garbhasha Mukha, and Yonigata Srav and the Katishul. So this is how our patient lands into this disease. It leads to the Yonigat Srava also, Katishula also, and the formation of Karnika. And we did the pap smear for her, and it was like negative for the intraepithelial neoplasia, and suggestive of inflammatory smear. Investigation was normal. Urine culture we also did, and no growth present was there. And pap smear was the inflammatory smear. Next. But we did like what treatment plan we followed. We did Yoni Dhavan with the Karanj Patrakwat. With the Karanj Patrakwat, we did the Yoni Dhavan, and it was mixed with the Sphatika, Tankad, and the Garrick. And after that Yoni Prakshalana, Yoni Pichu was done with the Nimbadi Tela, and it was done. Both treatment was done with for the 2 consecutive cycles for the 7 days. And along with this Sthanika Chikitsa, oral medications was also given. Chandra Prabhavati, 2 TID after food, Triflaguglu, 2 BD after food, and Gandhaka Rasayan, 1 TID after food. Like now we will discuss like why we use the Karanj Patra Kvata. Karanj Patra, and the reference of Karanj Patra is Bhav Prakash 120, and because of it is having that Katu Tikta Kashai Rasa, so the it plays a vital role in the Stambhaka activity also, like it restrains the Srava also. And in Bhav Prakash it is given that this because this Karanj Patra is Yoni Dosh Rit, and Kusht Udavart Gulm Arshnashak, and Vran, and it also effect on that Vrana also, and it is Krimighan and Kandughan. So the fresh leaves was taken, and it was the kashay was prepared, and 500 ml kashay was used for this yoni prakshalana, and it is followed by the yoni pichu with the nimbadi tela also. We know that it is creamy kusht kaf pranuhat, means it is vata kapahara also, vata kapahara kandughan, and the krimighan also. So because of this therapeutic actions and the kapha pitta shamaka properties and vata kapahara properties, this treatment protocol was followed. And the sphatika tankan garika, they are also kapha shamaka dahahara vranaropana, and in modern we can correlate with this anti-inflammatory action, antimicrobial action, and they are having antioxidant properties also, like tvaka prasadan also. So this played a vital role in the patient, and the oral medications was also given along with this Sthanika Chikitsa for 2 consecutive cycles and for 7 days. Next. Here, the picture is before treatment. Cervix was not visualized only, so discharge was that much. And during treatment, after cleaning the cervix, we are seeing the cervical erosion is there on upper lip and both upper lip and lower lip, both on both lip it was there, and the discharge was slightly greenish yellowish from coming out from the external os. And during treatment, picture is put, and after treatment a significant relief was seen, and symptomatically also, and by visualizing also, we can see like it was very significant relief in the cervical erosion. Next. Next is case second. um, a 32 years married female, homemaker by occupation, from Chandigarh, came to the hospital on 19/7/24 with a complaint of white discharge per vagina for 3 months. And she had complained of pain in lower back occasionally since 3 months, and pain during intercourse since 1 month, and staining of panties since 1 week. Menstrual history was she had regular menstruation. Last menstrual period was on 12/7/2024. For she had bleeding 3 to 4 days and 30 to 32 days. Obstetric histories, she had normal delivery. Her speculum examination was done. Cervix was hypertrophied, and erosion was present on both lips, and white discharge per vagina was present. Pervaginal examination was done. Uterus was anteverted, normal size, and tenderness in anterior fornix. Marital and sexual history was taken, and marital life was 8.5 years. Sexual history living together, coital frequency 3 to 4 times per week. Dyspareunia was present. Contraceptive history, she was using the condoms since 1 year. Next. Pap smear was done for her also, and it was negative for intraepithelial lesion. Nidana Sevan, here we are considering like Ati Methun and Vegadharan. Patient was patient had history of Vegadharan also, and Ati Methun, and these Nidana lead to the Apanavata Dushti, and Apanavata withholds the Yonigat Kapha and Rakta also, and leads to the Sthanika Masa Dushti, and leads to the formation of Yonigata Srava, Kati Shula, Methun Asahishunata, and formation of Karnika over the Garbhasha Mukha. This is how our patient gave the history, and accordingly, she got the symptoms. Formation of cervical erosion associated with the white discharge, and Katishula and Methuna Sahishunata. Next. Here we did the Yoni Dhavan with Nalpamar and Neem Makwatha for 7 days, and Unipichu with Jatyadi Tela for 7 days. Oral medication was given Chandraprabhavati 2 TID after food, and Trifla Guglu 2 BD after food, and Leucol tablet of Himalaya company we gave 1 BD after food. Nalpamar Quath. Nalpamar Quath, why we used? Because it is also having same Katu Tikta Kashai properties, and Vipak was Katu. Its action is Stambhaka action, Yoni Vishodhana, Vranaropana, and Kapha Shamaka. So, because of these therapeutic action, we use the Nalpamar Quad, and due to the Katu Tikta Kashai properties, it helps in the healing also, and it restrains the Srava also. And Yoni Vishodhana properties also, that Nalpamar Kashai having, and we are using the Chandraprabha Vati also. Same it is, ras is Katu Tikta Kashai, and action is mostly it is Deepana Pachana, Vata Kaf Hara, Shoth Hara, and Anulomak properties. And after that, we did the Yoni Pichu for the 7 days. Yoni Pichu with the 7 days with the Jatyadi Tela we gave. Last slide. Here we are seeing the significant difference. Patient almost completely healed with the cervical erosion. Uh, Now we are moving to the case 3. Married female of 32 years with complaint of white discharge per vagina associated with low back ache and lower abdominal pain since 6 years on and off. She had burning sensation over vulval region since 2 weeks, and dyspareunia was present, and menstrual history was 4 to 5 days bleeding, 28 to 30 days cycles, pain, smell, clots was absent, and she had normal delivery, vitals was normal, per speculum examination was done, cervix hypertrophied, erosion present on both lips, white discharge per vagina was present, and touch on bleed was there. Per vaginal examination was done, tenderness was seen in all the fornices, and we took the complete history, and she was taking that more Lavan and Katuras Pradhana diet. Bihar was she was taking the Divaswapna, which leads to the Kapha Pittaja Dosha Prakopaka, and Dushya was Rasa Rakta Masa, and leads to the Sanchaya of Dosha because of this Ama Utpatti, and Prakopa is Vatadi Dosha Prakopa was there, and leads to the Prasara, Sarva Sharir Sanchar of Dosha through the Vyanavata, and Khavegunya was Yoni, site of Apanavata, and Sthan Sanshra, Dosh Dushya Sapurshna in Garbhasha Griva, Kapha Pitta Dosh does the Kledan. Mostly like Kapha and Pitta does the Kledan, which leads to the discharges. And Vyaktasthana is Tvak and mass avdaran of the Garbhasha Griva, which leads to the formation of that protuberance is erosion. Next slide. Pap smear was done and it was suggestive of inflammatory smear. Next treatment plan was there because she was having that significant bleeding, like touch on bleed was there, so we used the Durva Kashaya because of its good Varnya properties and the Stambhaka properties, and it was also Katu Tikta Kashaya Ras Pradhana and Shita Virya, so we used the Durva Kashaya followed by the Yoni Pichu with Durvadi Tela, and it was done for the 3 consecutive cycles for 7 days, and oral medication was given, Leucol tablet 1 BD after food, Moksharadi Guglu 1 BD after food, Chandraprabhavati 2 BD after food, Ushirasa 15 ml BD after food, because she was complaining of burning sensation also, so we add the Ushirasava. And Durva Kashaya, we know that it is having the Shita Virya, so we use the Durva Kashaya for the Yoni Prakshalana, and it is having the Varnya, Tvak Prasadana, Kapha Pitta Shamak properties, and because of this Kashaya Rasa Pradhana, it pacifies the vitiated Kapha and Kleda, so it restrains the Srava because of its Stambhaka action. And after that we use the Durvadi Tela. In Durvadi Tela, like Til Tela is there, and Til Tela is very good for the Tvak Prasadana, and it is 3 dosha hara, so it pacifies the vitiated Kapha and Pitta, so we use the Durvadi Tela and Durva Kashaya in this patient. Next. This is how the Durva Kashaya was prepared. One part of coarse powder of Durva was taken and boiled in 16 parts of water until it reduced to half, and Durva Kashaya was prepared. Full Durva Panchang and water was used. Next. It is like while performing the procedure. We used mostly the 50 ml syringe or enema can for the Yoni Dhawan procedure. This is how like patient cervix was looking before treatment, during treatment, and after treatment. And the Durva, the Tela has mostly the property of this Lekhana and Vranaropaka and Shodhana and Tvak Prasadana. So it acts like excellently, almost full erosion was gone, and it was done for 2 cycles, and we got the good results with the Durva Kashaya. Next slide. Next is case 4. 32 years married female housewife came to Shri Dhanvantri Ayurvedic College and Hospital OPD with the complaint of white discharge per vagina with foul smell since 1.5 years associated with backache. Menstrual history was last menstrual period she had on 10/6/2024, 3 to 4 days cycles and 28 to 30 days cycle was there. And obstetric history is she was gravida 3. Normal delivery was done 2 years back, male, and perspiculum examination was done. Cervix was hypertrophied, erosion present on both lips, and white discharge per vagina was present. And per vaginal examination was done. It was antiverted, normal size and free fornices. Tenderness in fornices was absent, and this pap smear was done. Pap smear was negative for the intraepithelial lesion or malignancy. Next. Treatment plan for this patient, it was done with Yoni Dhavana with Triflaquatha, application of Apamarga Shara and Jatyadi Tel Yoni Pichu, and it was done for the 7 days. Triflaquatha is having Tridosh Ghana properties and Krimi Kusht Ghana properties, Kandu Ghana properties, and it is also having the Stambhaka properties also. And Shara, we know that it is Chedan, Bedan, Lekhan, and Dushit Mas Haran properties, which effectively works in this cervical erosion. And Jatyadi Tela Pichu was done for the 7 days. And along with this, the oral medication Kushanuk Churn, uh, 5 grams BD with Tandulodaka after food it was given, and Chandraprabhavati 2 BD after food was given. Next slide. And here we are seeing that before treatment, during treatment, and after treatment, it was done for the 7 days. And white discharge was completely absent, and mostly 60 to 70% patient healed up with this cervical erosion. And the extent of the cervical erosion was also decreased, and the associated symptoms was also decreased in this patient. Thank you. Thank you, ma'am.
Nicely presented, Jyoti.
Thank you,
You,
ma'am.
yeah, you shared your all the experiences on the cervical erosion.
Yes.
Have you ever tried Agni Karma in these cases?
Agni Karma, no, ma'am. I here we are not doing, but in our PG, we used to do Agni Karma also. But here in OPD basis, we are doing the Shar Karma, Yoni Prakshalan, and Yoni Dhavan only.
Okay, generally, in the cases of cervical erosion, lot many places, different type of shalakas have made by different people.
Yes,
Like
yes, ma'am.
some have made Panchadhatu shalaka, some have made the
Yes,
Suvarna
ma'am.
shalaka at Jamnagar, right? So lot many different types of shalakas are also people are using for Agni Karma. Like that is the we can say that replacement of modern cautery, right?
Yeah, yeah, yes, ma'am.
And in some places they are doing Agni Karma with the different vartis also.
Yes, ma'am. Vartis also.
Yeah, varti we can make the varti do Agni Karma with that varti. That is also beneficial in the cases of cervical erosion. Yeah,
Yes, ma'am.
right. Yeah. Now we can take up the questions from anyone if want to ask the
Yes, ma'am.
question. Yeah. Because in these cases, local therapies are important, not only oral medications, right?
Yes,
So
ma'am.
local therapies are beneficial and in practice, and they are giving result also. So they are very good in such type of cases, right? So anybody want to ask or add on? Yeah, Manjushri, you are having also experience on the cases of cervical erosion, I think. Dr. Manjushri.
Hello.
हाँ, Manjushri.
Hello. Namaste, madam.
हाँ, नमस्ते.
मैम बहुत ही अच्छा presentation था।
हाँ, प्रेजेंटेशन बहुत अच्छा बनाया लड़की ने, प्रेजेंटेशन बहुत अच्छा था।
थैंक यू मैम।
हाँ, हाँ,
एक ही मुझे पूछना था मैडम, उन्होंने दुर्वादी घृत जो बताया उसको लोकली देना था पीचू करके, या फिर ओरली
Yes,
देना
yes.
है?
No. Durvadi Ghrita and Durvadi Tela, both I used personally also. Durvadi Ghrita in the Yoni Pichu 5 to 10 ml lukewarm हम करने के बाद Yoni Pichu उसको Durvadi Tela से देते हैं, and Ghrita is also same. Like locally we used to give in the Yoni Pichu.
ओके, ठीक, थैंक यू।
Mostly we are using Durva Swarasa plus Palash in the patient who are having the touch on bleed, and if the like cervical erosion it up to the great extent also. So I personally felt that the Durva and Palash, if we are using together, and it is giving the good results.
ठीक है, थैंक यू। कभी कुछ कॉम्प्लिकेशन हुआ है, जैसे आपने ख्यार कर्म का बताया ना, उसका कुछ कॉम्प्लिकेशन हुआ है कभी, जैसे कुछ
अभी तक तो
ज्यादा?
ऐसा कुछ हुआ नहीं है, कॉम्प्लिकेशंस तो देखा नहीं है अभी हमने ना ओपीडी पे, ऐसा कुछ हमें मिला नहीं है कि कॉम्प्लिकेशन हुआ है किसी पेशेंट को।
ओके, थैंक यू।
अंजना मैडम, आपके एक्सपीरियंसेस यू कैन शेयर। अंजना
जी
मैडम।
मैम, जी मैम,
जी मैम,
नमस्कार मैम।
नमस्कार।
सभी लोग को
नमस्कार।
जी जी मैम। जी मैम, बहुत प्यारा था, बहुत ही कहना चाहिए ना, कम उसमें इन्होंने बहुत अच्छे से प्रेजेंट किया मैडम आपने, और बहुत अच्छा था, नाइस प्रेजेंटेशन आपका। और आपकी जो
थैंक यू मैम।
प्रोनाउंसिएशन के साथ साथ जो आपकी स्लाइड्स थी वो बहुत प्यारी थी, और केसेस के बारे में
थैंक
भी
यू
आपने
मैम।
बहुत अच्छे से बताया। और ये जो अपने कर्णी योनि व्यापद में एक जो वो वाला केस बताया, जिसमें आपने बताया कि उसको लेबर पेन नहीं थे या भी नहीं था, उस समय भी उसने
यस।
पेन लिए थे, और वो वाला केस बहुत अच्छा लगा। और इस तरह
थैंक
की
यू
हिस्ट्री
मैम।
अक्सर देते हैं, और आपने उसको अच्छे से लिया और उसका ट्रीटमेंट किया। और
यस।
बहुत अपर मार्ग क्षार पर हम लोग भी यहाँ पे वर्क करा रहे हैं, क्योंकि जो हमारे
हाँ
पास
जी।
इरोजन के केसेस आते हैं, और
हाँ
रियली जो
जी।
आपने फोटोग्राफ्स दिखाए वो रियली बहुत अच्छा लग रहा है कि इम्प्रूवमेंट हो रहा है। और एक्चुअली मैडम, यहाँ पे हम एक बात और बताना चाह रहे थे कि जैसे आप लोगों ने पेपिसमेर वगैरह तो कराते ही है, सभी पेशेंट का हम लोग कराते हैं।
हाँ
और
जी
कभी
मैम।
कभी कभी क्या होता है कि पेपिसमेर में जब हम लोग टेस्ट करते हैं तो डिस्प्लेजिया आता है, कभी कभी किसी किसी केसेस
Sometimes
में।
we used to get that dysplasia.
हाँ,
Yes.
या मैम। तो उसके बाद फिर हम लोग जनरली पेशेंट का नेक्स्ट स्टेप पे एलवीसी विद एचपीवी डीएनए
Yes.
करा लेते हैं एक
हाँ
बार,
जी।
क्योंकि है ना,
हाँ जी।
और उसके उसके बाद भी अगर हम लोग प्रॉपर ट्रीटमेंट देते हैं और फिर इन्वेस्टिगेशंस कराते हैं तो रिजल्ट्स अच्छे
हाँ जी।
आते हैं। ऐसा आपका भी कुछ एक्सपीरियंस है क्या?
यस मैम, ऐसा है कि हमें मतलब लाइक डायग्नोसिस के बाद इन्वेस्टिगेशन इज वेरी इंपॉर्टेंट।
या
along with pap smear also we can go for the vaginal swab, high vaginal swab and associated with culture also we can go,
जी
कि
जी
हम
जी
अगर हमें पर्टिकुलर अगर हमें पता चल रहा है कि कॉज दिस इज द कॉजेटिव फैक्टर, तो हम हमारा ट्रीटमेंट और अच्छे से कर सकते हैं।
जी मैम। तो यही इसी को यहाँ पे, क्योंकि जनरली जिस तरह के जो केसेस आते हैं, और जैसे आपने एज फैक्टर भी बहुत अच्छे से डिफाइन किया हर केस में, तो जनरली
हाँ
एक
जी।
तरह प्रोटोकॉल भी बना है, गवर्नमेंट का प्रोटोकॉल भी बना है। और सर्वाइकल कैंसर्स जो है इस समय नंबर 1 पे चल रहा है, बताते हैं कि हर 8 मिनट में एक डेथ हो रही है इसके कारण। तो ये एक बहुत अच्छा हमारे पास रहेगा कि हमें एचपीवी, मतलब सबसे पहले हमें यही कराना है, पेपिस्मेर ही कराना है। और पेपिस्मेर के
हाँ
बाद
जी।
जो आगे के इन्वेस्टिगेशंस हैं तो वो हमें एक बार कंफर्म करा लेने चाहिए। और जैसे मैडम ने बताया शलाका वाला, एक
हाँ
क्वेश्चन
जी
शायद
मैम।
इसमें एक क्वेश्चन शायद इसमें ये भी आया है, कॉपर सल्फेट या तुथ का, तो वो भी एक तरह से क्षार का ही है। और हम लोग जब
ये
यूजी
तो
पीजी में थे।
हाँ जी।
जी,
हाँ जी।
आपने
हाँ
यूज
जी।
किया मैडम? पहले आप बताइए मैडम, आपने यूज किया कभी
नहीं
इसको?
मैम, हमने पर्सनली यूज नहीं किया, मतलब वी यूज
जी
टू लाइक अपामार्ग क्षार, स्नूही क्षार
जी
एंड यवक क्षार, कदली
जी
कंद
जी
क्षार वी यूज टू
जी
यूज।
जी जी जी। लेकिन पीजी के समय जब हम तिवारी मैडम, प्रोफेसर पीवी तिवारी मैडम के अंडर में थे, एमडी कर रहे थे, उस समय हमारे यहाँ यही यूज होता था, तुथ जिसे कहते हैं, कॉपर सल्फेट वाला क्षार, और उसके रिजल्ट्स भी बहुत अच्छे मिलते थे। 20 साल पहले की
हाँ
बात
जी।
हम बता रहे हैं, 25 साल पहले की। लेकिन ये था कि इसका जो भी किसी ने कुछ शायद क्वेश्चन पूछा है, तो उसमें भी यही है कि योनि प्रक्षालन करना है, प्रक्षालन करके क्षार लगाना है। और क्षार को
हाँ
बोला ही जाता है कि क्षार एकदम कम समय के लिए लगाया जाता है, 1 2 3 जैसे सेकंड्स के लिए। और उसके बाद उसका रेस्पॉन्स देख के फिर उसको वॉश करके और उसके बाद फिर योनि का प्रक्षालन किया जाता है। और हम लोग वीकली करते थे, किसी किसी पेशेंट में 10 दिन या 15 दिन में भी करते थे अकॉर्डिंगली। तो इस तरह
हाँ
का भी
जी।
क्षार कर्म होता ही है। और ये क्योंकि ओपीडी प्रोसीजर होता है तो पेशेंट को रेस्पॉन्स मिलता है, तो इसलिए मैंने पूछा। क्योंकि लेकिन अब ये हम लोग भी जनरली अपना मतलब थीसिस के जो कुछ टॉपिक्स होते हैं उस पर डिसाइड करते हैं, तो ड्रग्स पे थोड़ा सा कॉन्फिडेंट रहते हैं हम लोग, क्योंकि जो भी थीसिस
यस।
होती है उस पर ड्रग्स अच्छे से बनाई जाती है। तो अब हमारा क्षार पे भी किया है, और जैसे मैडम ने कहा था पंचशलाका वाला भी हम लोगों ने
हाँ जी।
एक एक केस हमारे यहाँ चल रहा है, इसका थीसिस का चल रहा है। तो उसमें भी हम लोग ये काम कर रहे हैं इरोजन में, और रेस्पॉन्स अच्छा मिलता है। थैंक यू
हाँ जी।
फैमिली मैम, थैंक यू, आप बहुत अच्छा कर रहे हैं, बहुत अच्छे से बच्चों को लेके आ रहे हैं, और बहुत अच्छा लगता है आपके साथ जुड़ना और इसको सुनना। थैंक यू मैम।
थैंक यू मैडम। रमादेवी मैडम,
Namaste, ma'am.
नमस्ते।
नमस्ते।
योर ओपिनियन ऑन दिस केस सर्वाइकल इरोजन।
Cervical erosion cases we used to do regularly, madam. And I got one other complications means like patient sometimes complains burning sensation and excessive white discharge during the procedure time. Not all the patients, few patients, but it is reduced after that when this course is completed.
Okay.
Hello.
Yeah,
Completed
yes,
like
yes,
that.
ma'am. Yes, ma'am.
Like complications means sometimes few patients like Varti we are giving means Shodhana Varti, no madam, all Tikshna Dravyas, no, few patients complains burning sensation, but first 1 or 2 days we are giving 7 days Varti. That complication I met, but otherwise it is all the procedures explained in classics is good. Varti is good, but Pichu also we used to practice, madam.
Yes, madam. In the cases of when there is burning sensation,
Mm.
you do yoni pichu with madhyastadi tel after this
Mm.
dahan
Mm.
karma or
Mm.
varti. You can use that also. Madhyastadi tel yoni
Yeah,
pichu
yeah.
is very beneficial in such
Yeah.
cases.
Okay.
And different experience is that udum sneha pichu.
Okay.
Yeah, Udumbar Sneha Pichu is very good in such
Very
type of
good.
also.
Mm.
Yeah, and that is also,
Udumbara Taila we gave for one thesis, madam. Udumbara Taila.
yes, Udumbar
But
there is same.
Taila,
Yeah,
that is given. But
yeah,
no, some we used to give that Trifala douche we are giving, madam, after the Varti. Otherwise, I mean, like two groups, one Trifala given, one lukewarm water Yoni Prakshana given, madam. Both gave actually good result. Means
yeah,
cleaning
yes,
that washing actually
yeah.
anything left like Varti remnants like that maybe burn, it may burn no healthy tissue like that we I came to know like my experiences like this.
And what about madam recurrence in these cases? What is your opinion?
Recurrence is there, madam, but not that in month. But one patient, madam, repeatedly she used to come. Actually, we done all the investigations up to HIV like that, but it didn't get all negative only. But she used to get mostly mode of life. Maybe she's a laborer, madam, working in the field and all. She used to get repeatedly hypertrophy, once erosion like that. She used to get, but that is symptomatic treatment only. We are giving modern people advise hysterectomy. We were not agreed for that, and somehow it was treated, but she used to get repeatedly, madam. Then in that case, actually, I failed.
Yeah,
Repeatedly, she used to
that
get one patient
yes,
only.
yes. That was my point, madam.
Uh, um,
Recurrence in the case is of the female. We have
um,
having history of that case, and
um,
you are rightly pointing
um,
that laborer cases. In laborer cases,
um.
we have to ask the frequency of sexual act.
Yes,
Yeah,
yes, ma'am.
that repeatedly, repeated.
Yeah, maybe, madam.
Yeah,
She delivered 5 children.
yes. In
Five
those
children.
cases, yeah,
Um,
frequency
maybe
of this sexual
the sexual act. Yeah, definitely.
uh,
That is there,
that is
madam. Definitely.
predisposing factor of this
Factor. Yes, madam.
recurrence of cervical
Mm,
erosion. That
mm.
is the
Yes,
observation of our
yes,
patient.
madam. That case only actually they advised hysterectomy. She don't want. That's why she came to me. But repeatedly when there is a complaint, she used to come to me only. It is not near also. It is 2 to 3 hours from Udupi. but she's coming, taking treatment and going. But after 1 or 2 years, she's coming back like that. To postpone hysterectomy, she came to me. Postpone, should cancel hysterectomy, she came to me like that. But that case actually, but that means symptomatic relief. That time it relief. Again, that is because the patient is indulging in the nidana, like a sexual active diet, mode of life, and all those things maybe leading to recurrence of the erosion. But most of the patients' associated symptoms and all are reduced. Conceived, few patients conceived, but failure also there in that.
Yes, but in those cases, frequency of coitus is also there,
That
and
only we
dyspareunia.
have to back.
Yes,
Yes,
dyspareunia
ma'am.
is also the complaint.
Complaint is.
Yes,
Yes,
dyspareunia is
ma'am.
also the complaint when we are doing PVS examination with the complaint of dyspareunia, there will be cervical erosion.
Yes, madam.
Yeah, in this laborer cases, lot many times, and it's like that. Yeah, and due to that unhygienic condition also is the predisposing factor in those cases. Yeah, है ना?
Thank you, ma'am.
Yeah, मैडम, थैंक यू. और कोई अपना क्वेश्चन पूछना चाहें या अपना ओपिनियन कुछ बताना चाहें तो डॉक्टर राजकृंती अपना एक्सपीरियंस शेयर कर सकती हो. तुम्हारे भी काफी अच्छे केसेस रहते हैं, अगर हैं तो. राजकृंती है तो.
जी नमस्ते मैम.
हाँ, नमस्ते.
मैम आजकल आ रहे हैं, बहुत केस आ रहे हैं ऐसे, जैसे वाइड डिस्चार्ज के और इचिंग और बर्निंग वाले तो होते ही हैं, बट आजकल जो सर्वाइकल इरोजन वाले हैं ना, वो बहुत केसेस आ रहे हैं. और पता चलता है जब हम उत्तर बस्ती करते हैं उस टाइम पे पता चलता है, जैसे पेशेंट का कसकोस हम डालते हैं तो किसी किसी को तो टच वन ब्लीड होने लगता है मैम. और अभी तो फिलहाल मैंने 4-5 केस में तो योनि प्रक्षालन शुरू करवाया है, योनि प्रक्षालन करा के और वही पिचू करवा रहे हैं मैम जाते भी तेल से. तो प्रक्षालन और पिचू कराने पे आराम तो मिल रहा है. त्रिफला चूर्ण में थोड़ा सा चंदन चूर्ण मिला देती हूँ मैं.
देखो,
तो
मैंने कहा ना कि इसके केसेस थोड़े से डिफरेंट होते हैं. अभी तक किसी ने नहीं बताया चंदन चूर्ण मिलाते हैं. डॉक्टर राजकृंती सिंह चंदन चूर्ण मिला लेती है. ये पित्त का इन्वॉल्वमेंट रहता है, जैसे मैडम ने अभी बोला, पेशेंट्स आर हैविंग बर्निंग सेंसेशन, तो वहां हमने तेल और वो स्नेह सोचा, बट तुम्हारा थोड़ा सा डिफरेंट आया कि हाँ, चंदन चूर्ण मिला लेती हूँ.
जी मैम. और पेशेंट
गुड.
मतलब 4-5 साल से मैम इतना परेशान था वो कि पूरी रात तो वो यूरिन के लिए जाता था. और मैंने जब उसका यूरिन रूटीन माइक्रो कराया तो मतलब फुल पैक्ड उसका पस सेल्स था. और वो बोली कि 1 सेकंड के लिए उसको आराम नहीं मिला. शुरू के 5-7 दिन तो मैंने सोचा ओरली देख के देखते हैं, बट उसको कोई रिजल्ट नहीं मिला. फिर मैंने सीधा, क्योंकि यहाँ पे पंचवल्कल वैसे अवेलेबल नहीं होता मैम इजीली, तो त्रिफला चूर्ण के साथ फिर मैंने उसको चंदन चूर्ण मिला के उसी का प्रक्षालन करवाया और जाते भी तेल का पिछू रखवाया. तो आज सेकंड डे था, पेशेंट आया मेरे पास, बोले मैडम आज 3 साल में जाके पहली बार मैं चैन की नींद सोई हूँ, मुझे इतना आराम मिला. तो ये मेरे को अच्छा लगा ये केस, और अभी मैं उसको कंटिन्यू करने वाली हूँ. और बाकी तो फिर मैम अभिवर्ती का मैं भी सोच ही रही थी, अप्लाई नहीं किया, पर जैसे हम जामनगर करते थे ना मैम, योनिवर्ती नीम की रुन की बना के नींबू
हाँ,
पत्र
नीम
की.
वर्ती से अग्निकर्म, है
जी
ना?
मैम. तो और वो भी बनाए थे कृतिका दीदी ने, जैसे वर्ती जैसे ही बना के फ्रीजर में रख के और वो यूज करते थे. बट कभी कभी क्या होता है, पूरी तरह से वॉश आउट नहीं होता ना, तो पेशेंट को उल्टा फंगल
फंगल
इन्फेक्शन होने की
इन्फेक्शन होता. हाँ, हाँ, हाँ,
जी मैम.
हाँ.
और
नहीं,
बाकी
वर्ती
तो
रखना नहीं,
में,
वर्ती से अग्निकर्म.
हाँ अग्निक्रम ठीक है मैम, क्योंकि
हाँ,
अग्निक्रम करके तो साथ के साथ धूपन कर्म भी हो जाता है, पेशेंट को बड़ा
हाँ,
अच्छा रिलीफ मिलता है.
हाँ.
तो अभी मैं स्टूडेंट से बनवा रही हूँ वो बकरे के मूत्र के साथ जो था ना, बस्त मूत्र के साथ जो बनाना था कुष्ठ वगैरह, तो अभी मैंने कलेक्ट किया है, बना के वो भी शुरू करूंगी मैम मैं.
हम्म.
और
हाँ, वो भी
बाकी
बहुत
अपने,
अच्छा प्रयोग है, वो कुष्ठ और
जी
इसका वस्त्र
हाँ
वाला,
बस्त
उससे
मूत्र
वर्ती
वाला,
बना के अग्निकर्म करना.
हाँ
उसमें
जी
क्या है,
मैम.
आपका लेखन भी होगा साथ में,
जी
अगर
और
गोमूत्र भी है तो लेखन भी हो जाता है ना?
जी मैम, और धूपन कर्म भी साथ के साथ हो जाएगा. तो ये अभी मैं शुरू कराने वाली हूँ. बाकी अपने वहाँ तो मैं वो स्वर्ण शलाका से करते ही थे सर्वाइकल
हाँ,
इरोशन के
हाँ, हाँ, हाँ,
ऊपर.
हाँ, हाँ, हाँ.
जी. और साथ में मैडम ओरल में भी, जैसे हमारे यहाँ एक प्रैक्टिशनर है पुराने, तो बोलते हैं कि कोई भी यूरिनरी डिसऑर्डर है जैसे, तो चंदन आप साथ में ऐड कर दो. जैसे हम चंद्र प्रभा वंशशील ये सब तो देते हैं, पर चंदन ऐड करने से ना बहुत अच्छे रिजल्ट मिल रहे हैं। अभी मैंने इस मंथ ही शुरू किया है मैंने। बाकी मैं
हम्म,
जैसे वो होता था वो जो एडिनोमायोसिस वगैरह के जो केस आते थे रक्त दुष्टि वाले, उनमें तो मैं बस्ते वगैरह में चंदन चूर्ण ऐड करती हूँ, बट अब इसमें भी मैंने शुरू करवाया है, तो मुझे अच्छे रिजल्ट मिल रहे हैं मैम।
गुड गुड गुड, बढ़िया।
जी मैम।
हम्म। पर इसमें चंदन, फिर उसमें आपको रक्त लेना है, श्वेत लेना है, क्या उसमें
रक्त
डिफरेंस है?
चंदन मैडम, रक्त चंदन यूज में ले रही हूँ मैं।
हाँ, ओके ओके ओके,
जी
नाइस
मैम।
नाइस नाइस।
जी
क्योंकि जब लोकल एप्लीकेशन करना है तब श्वेत चंदन लेते हैं ना, फेस
हाँ
वगैरह वगैरह के
जी
लिए।
जी 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 मैम, पर ये जो रक्त चंदन है एंटी बैक्टीरियल है। सर ऐसे
हाँ
बोलते हैं, बोले कि चंदन के पेड़ को कभी दीमक नहीं लगती है, बोले उनका कंसेप्ट ये है कि कोई भी
हाँ
इंफेक्शियस डिजीज है ना तो आप उसमें
हाँ
बोले आंख
हाँ हाँ
बंद करके
हाँ,
इससे यूज में लो,
राइट राइट
रिजल्ट
राइट
मिलेंगे।
राइट राइट, वेरी गुड, बहुत बढ़िया। हाँ हाँ हाँ
जी मैम, तो उसी कंसेप्ट को लेके मैं यूज में ले रही हूँ।
हाँ,
ओवेरियन सिस्ट है जहाँ पे भी, हेमरेजिक सिस्ट है, लेखन बस्ती भी करती हूँ, तो उसमें भी मैं कल्क फॉर्म में चंदन डालती हूँ मैम।
वेरी गुड, नाइस।
जी मैम।
बढ़िया, बहुत अच्छी बात है।
जी मैम, थैंक यू मैम।
हाँ। किसी और ने कुछ अपना एक्सपीरियंस शेयर करना है या पूछना है तो पूछ सकते हैं। डॉक्टर जल्पा, जल्पा पटेल। दिख तो रही हैं डॉक्टर जल्पा, सुन रही पा रही हैं? हम्म, शिल्पा पटेल तक मेरी आवाज नहीं जा रही है, तो ठीक है। हमारे ऑलमोस्ट क्वेश्चंस तो आई आई डोंट थिंक और ज्यादा क्वेश्चंस हैं इसमें। इसमें
वंदना
धा-
वंदना जी है हमारे साथ, डॉक्टर पवन है हमारे साथ।
पवन जी का क्वेश्चन होता है तो वो
कुछ
पूछ लेते हैं, अभी वो पूछेंगे नहीं मुझे लगता है।
हाँ,
पवन
नहीं
जी,
रेगुलर साथ जुड़ते हैं,
हाँ वो जुड़ते
अच्छा
हैं
लगता
पवन
है।
जी, और पूछते भी हैं। उनका क्वेश्चन होगा तो पूछ भी
हाँ हाँ,
लेंगे।
बहुत।
हाँ हाँ हाँ, वंदना मैडम।
वंदना जी नमस्कार। वंदना पाठक जी तक हमारी आवाज जा रही है क्या?
उनके भी क्वेश्चंस होते हैं, वंदना मैडम के भी ज्यादातर।
हाँ, मंजूश्री जी भी जुड़ती हैं हमारे साथ रेगुलरली,
मंजूश्री ने तो अपना
लेकिन
शेयर कर
क्वेश्चन कम
लिया।
पूछ।
मंजूश्री ने अपना शेयर कर लिया,
जल
सबसे पहले मैंने उसी को इनवाइट किया था, मंजूश्री को।
जलपा जी,
जल्पा नहीं बोल रही है, जल्पा नहीं बोल रही है पवन जी
इसके
को।
बाद वाला सब्जेक्ट बड़ा यूनिक। लेडीज टेक्सटाइल को पसंद करती हैं, तो अगला टॉपिक हमने रखा है हर्बल एंड हेम्प टेक्सटाइल। हर्बल से बनने वाली टेक्सटाइल, हर्बल डाइंग फॉर टेक्सटाइल, यूनिक कंसेप्ट हमारे आयुर्वेद से होता है। और उसके साथ जो हेम्प फाइबर है, कैनबिस फाइबर, उससे टेक्सटाइल बनती हैं, कपड़े बनते हैं। तो ये बड़ा यूनिक सब्जेक्ट है। अब लाता तो मैं यूनिक हूँ, लेकिन वो आप लोग चले जाते हैं तो बड़ा कुछ पूछना चाहें, otherwise we can conclude the webinar. Our next speaker has come, Mr. Thanga. Welcome. Thanga
हाँ,
is
हम कम से
MBA, dyeing expert,
हम्म,
herbal dyeing expert।
अच्छा।
बिल्कुल अलग। आप देखेंगे इनके प्रेजेंटेशन में कैसे ये कलर करते हैं, कैसे वो क्वाथ
हाँ,
बनाते हैं, हर्ब से कैसे रंग बनाते हैं, और फिर वो डाई करते हैं उससे। क्या नो
हम्म
केमिकल डाई एट ऑल।
हम्म।
तो और ये
हम्म,
आप हर्बल में है, और दो दो फाउंडर हैं हेम्प फाइबर के। तो वो हेम्प टेक्सटाइल बनाते, सभी यूनिक है। तो मैं कंक्लूडिंग रिमार्क्स के लिए फिर कामिनी धीमान जी को आमंत्रित करता हूँ।
जी जी जी, बिल्कुल। आज का हमारा जो टॉपिक था सर्वाइकल इरोजन, दैट इज रियली वेरी कॉमन थिंग, जैसे कि डॉक्टर राजा कृंती ने बोला कि कॉमन प्रॉब्लम है ओपीडी के हमारे पास पेशेंट्स आते हैं, और जैसे मैंने स्टार्टिंग में बोला था कि पेशेंट कंप्लेंट लेकर नहीं आता है कि मुझे इरोजन है ना। हाँ, कुछ और कंप्लेंट लेकर आता है, जनरली कॉन्टैक्ट ब्लीडिंग की, वाइट डिस्चार्ज की कंप्लेंट लेकर आते हैं। तो हम उनको जब चेक करते हैं तब हमें पता चलता है कि पेशेंट को इरोजन है, एंड देन अकॉर्डिंग टू दैट हमें डिसाइड करना है कि हमें क्या करना है। अलग अलग ट्रीटमेंट जो डॉक्टर ज्योति ने बताया कि किसी में हम प्रक्षालन करते हैं, किसी में पिचू करते हैं, किसी में हमने वर्ती दिया, किसी में अग्निकर्म किया, किसी में क्षार कर्म किया। तो सारी ट्रीटमेंट जो है वो बेनिफिशियल रहती है, बट इनका सबका एम क्या है, मतलब वो थोड़ा सा हमें समझने की जरूरत रहती है कि एम क्या है। कि हमारे पास क्या हुआ है, स्क्वैमो कोलमनर जंक्शन बाहर की तरफ आ गया, ऑल्दो दैट इज नॉर्मल थिंग, बट जहां जैसे बोलते हैं ना अनाधिकार चेष्टा होती है कि उसका स्थान ही नहीं है, उस स्थान में जंक्शन बाहर को शिफ्ट हो गया है। तो वो जो बाहर शिफ्ट हो गया उसको अंदर हम शिफ्ट नहीं कर सकते, लेकिन जो बाहर आ गया उसको हमें खत्म करना है, जिससे कि वो चला जाए और उसकी जगह फिर से जिसकी जगह है वो अपनी जगह आ जाए, लाइक दैट। तो इसके लिए अलग अलग क्षार कर्म किया तो भी जो कॉलमनर एपिथेलियम बाहर आया वो खत्म हो जाएगा, तो वहां पर स्क्वैमस एपिथेलियम फिर से नीचे से रीजनरेट हो जाएगा, दैट इज द पर्पस। और जो पिच्चू वगैरह है वो कैसे इफेक्ट करता है, तो वो रोपण करके कि जहाँ ठीक है इरोजन जैसी कंडीशन बन गई है, उसमें से डिस्चार्ज हो रहा है अनहेल्दी सेल्स वहां पर, जैसे कि मैडम ने बोला कि हम एग्जाम टेस्ट करते हैं, पेप्समीयर वगैरह कराते हैं, तो उसकी रिपोर्ट्स ये आती हैं। ये सारे जो अनवांटेड सेल्स ही बोल सकते हैं हम इनडायरेक्टली, तो उसको हमने हटा के तो वहां पर जिसका स्थान है स्क्वामस एपिथेलियम भी से रीजनरेट हो जाएगा। तो वो वहां पर जो सर्विक्स का एरिया है उसमें वहां पर फिर से हेल्दी टिश्यू रीजनरेट होकर की सर्विक्स की जो इंटेग्रिटी जो है दैट विल बी मेंटेन्ड। ये इसका पर्पस रहता है। अदरवाइज ये रिपीटेडली होता है, रिपीटेडली हो रहा है तो पेशेंट को अननेसेसरी डिस्कम्फर्ट है, वाइट डिस्चार्ज है, कॉन्टेक्ट ब्लीडिंग है, और लॉन्ग टर्म में अगर रिपीटेडली वैसे कहीं भी एबनॉर्मल सेल्स बन रहे हैं या ग्रो कर रहे हैं तो कैन बी कन्वर्टेड इनटू कैंसर। तो इसका ट्रीटमेंट करना ही एक कैंसर का प्रिवेंटिव एस्पेक्ट हो सकता है। इसीलिए हम इस पेशेंट्स को जो है वो ट्रीटमेंट करते हैं, हमारे पास आते हैं। और बहुत अच्छे से ज्योति ने पेपर भी प्रेजेंट किया है, अपना प्रेजेंटेशन दिया, बहुत अच्छे केसेस उसने डिस्कस किए।